Hi, I'm Dr. Kretschmar, helping you to win with ADHD. Today I want to talk about some natural approaches to ADHD treatment, and one commonly utilized natural treatment is talk therapy. I'm a big fan of talk therapy, and I receive referrals to my functional medicine and neurofeedback clinic here from psychologists, hundreds actually, of referrals from psychologists and therapists over the last few years. And I refer back to these therapists so that they can have these sit-down talk therapy sessions with my patients, their clients, and this can be very effective in helping the individual and the individual's family, and also their teachers at school, to help the individual cope with the symptoms of ADHD, to cope with the complications and the ramifications of those symptoms. So talk therapy is good. Does it help to actually alleviate the symptoms? I haven't really seen that to such an extent. In my office, I actually have many psychologists and therapists themselves as patients, or their families. So it's useful, but does it get rid of ADHD? I would have to say no. Not that it's a bad thing, and I'm not downplaying talk therapy at all. I think it can be very, very useful, like I said, for the individual and for their families. So supplements. Supplements are something else that you can do to help to combat the symptoms. Some simple ones: B complex. A lot of people are deficient in B complex. Everybody's heard of fish oil or flaxseed oil. Those essential fatty acids are very beneficial in the neurons or the brain cells, and very important for their functionality. Those are a couple of things that can be done. However, in my office, I go way beyond that, and the functional medicine approach is to actually run specific blood tests for nutrients to see if there are exact deficiencies that can be supplemented. Also food sensitivity testing, because if we're eating foods that we're sensitive to, you can get inflammation in the gut, you can get inflammation in the brain, you can have decreased absorption of the very nutrients that you're trying to supply to the brain. One of the other things that we do in our office, which is a huge success, is neurofeedback, sometimes called EEG biofeedback, and it is biofeedback for the brain. So this starts with a brain map, or a QEEG test, a quantitative electroencephalogram. So with this test, we can see exactly how the brain waves are functioning in every region of the brain, much like an EKG measures the electrical activity of the heart and heart muscle. So we can have a look at the brain very precisely and analyze the brain waves, and we can have a look to see what is causing the difficulties that the patient is having with ADHD, whether it be focus and attention issues, impulsivity, hyperactivity, or all three of those symptoms. So we look at the brainwave patterns. We see if they're normal or are they abnormal. If they're abnormal, we look to see if those brainwave patterns are consistent with this patient's exhibited symptoms. If so, and if there's no red flags in the detailed history we do, then that patient is a good candidate for the neurofeedback brainwave training, where we can utilize operant conditioning to train those brainwaves back to normal, and with that comes increased brain functionality and a reduction in symptoms. So those are some of the exciting things that are available, utilizing functional medicine and neurofeedback. Let me know in the comments below, have you tried any of these? Do you have ADHD? What kind of symptoms are you experiencing? What have you tried that's worked? What have you tried that hasn't worked? I'd love to hear about it. Leave the comments below. And if this video was helpful to you, please hit the like button, subscribe so that you can be made aware of subsequent videos coming your way. Thank you for your attention, and be well.